Hi, good morning Shannon. My name is Anne William. I'm your invigilator for the OET speaking session on the 29th of January 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Shannon Gray.
And what is your candidate number, please?
My candidate number is 214215532.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Tell me about a time when you committed a medical error in your nursing career. How did you handle it?
When I was a new nurse, I was very watchful in my practice, but I did make a very serious medical error when I first started working on my own, on the pediatrics floor at the hospital. In pediatrics, weight is usually documented in kilograms, since recommended medication doses are documented in kilograms. Upon intake, I entered the patient's weight in the system, and when it automatically converted to kilograms, I thought it was a mistake, so I adjusted it up, so it would reflect the patient's weight in pounds. This was a big mistake on my part, because the patient would be getting much more medication than they were supposed to. At first, I didn't realize what I had done, but later, while I was entering history and physical on another patient, I realized my mistake, and as soon as I was finished with that patient, I immediately went and informed my supervisor of my mistake. Luckily, the patient had not received medication yet, but an error was still documented, and I went through a training program to ensure I understood how to properly document weight.
How have you responded when your supervisor asked you to work an additional shift to fill vacancies?
I know that while working as a nurse, teamwork and helping cover the shift for each other is important. In my current position, we have policies on notification for paid time off, shift swapping, and calling in sick. I have been open to help cover extra shifts when needed regardless of 12-hour shifts. Staying over for some extra time on shifts is okay for me as long as I have some notice. Because I need to make childcare arrangements for our little ones.
How do you prioritize when multiple patients and procedures demand your attention at once?
When I was a nurse in the emergency department, there are times when the action is crazy with patients coming in. During these times, I always remember that the needs of the patient come first. So my triage skills come into use to prioritize which patients are the highest priority and which ones can wait. During these particular times, communication is extremely important for patients. If they are going to have a time period to wait, I communicate to them and check in with them when I am able to. As well, during these busy times, it is equally important for our team of nurses and physicians to stay in communication. From there, I stay calm and handle patients with quality care, one at a time.
Tell me about a time in which you had to handle an irritated physician, co-worker, or patient. How did you handle it, and what were the results?
When I was a nurse in the clinic, we had a patient one day that was demanding more narcotics for her pain. She had walked into the clinic without an appointment to demand another prescription. As the only nurse in a small clinic that day, I sat the patient down to talk to them. I used a calm voice and listened to what they were asking for. After listening, I explained that I would need to check their records for their last prescription and speak with the attending physician in the clinic. After seeing that their last prescription was written many months ago, and the patient had missed their last appointment, I was able to talk to the physician to get another prescription written. Once prescribed, I explained to the patient how it was important for them to keep their regularly scheduled appointments. And she walked away happy.
How do you make seamless transitions on shift changes?
At my current position, we have a process for transitioning at shift change. To start, the nurses coming off shift and those coming on have a huddle. That is led by the unit supervisor at each shift change. Here, Any significant issues with patients are discussed. Next, if any work remains to be done with the patient, we communicate to each other, one-on-one, to ensure that the needs of our patients are met.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hi, good morning. My name is Shannon Gray, one of the nurses in the clinic. May I know your name for the record, please?
My name is Anne William.
Thank you, Anne. May I know what brings you here today?
Nurse, I am very much worried that I have been experiencing some heart palpitations.
I acknowledge that. For diagnosis purposes, may I ask you a few questions, please?
Sure, of course. You may please.
Thank you for your consent, Anne. When you say heart palpitation, could you please brief What exactly you experience?
I feel like the heart fluttering rapidly, and beating too fast.
Okay, have you ever noticed any particular circumstances which trigger your condition?
Actually, I tried to figure it out. But one day, it occurred when I was sitting in a chair, in a relaxed manner, and I was reading a storybook. So I got very tense.
All right, I understand that. Although heart palpitations can be worrisome, they're usually harmless. Only in rare cases, they can be a symptom of a more serious heart condition, such as an irregular heartbeat, that might require treatment.
Okay, nurse. So you want to convey that there is nothing to be worried about?
Yes, but before reaching a conclusion, let me ask you some questions.
Sure.
Is your profession causing much stress?
Oh yes, I have stress and anxiety as every lawyer would have.
Okay. I realize that. By the way, do you have any habits like smoking, drinking, or too much consumption of sweets or junk foods?
Not really, but I eat fast food very often, and consume large amounts of coffee.
All right, Ain. From analyzing your words, I could suggest that your symptoms could be triggered by your current level of stress and anxiety.
Okay.
Being a lawyer, you will be leading a life demanding strong emotional responses, such as stress, anxiety. Perhaps, not to be worried too much, as the symptoms are not due to any coronary problems. As per the ECG done on your arrival, and physical examination, you are absolutely normal.
Oh, it's really good to hear, nurse.
However, you need to go through a systematic management approach, and follow a healthier diet, to control your heart palpitation.
Okay. I got it. Nurse, could you please guide me?
Sure, of course. With pleasure. In your case, areas to be focused on are stress management and reducing caffeine intake.
Okay. What can I do about that?
To start with, physical activity can help improve your sleep. And better sleep means better stress management. People who exercise also tend to feel less anxious and more positive about themselves. When your body feels good, your mind often follows. Get a dose of stress relief with these exercises: running, swimming, dancing, cycling, aerobics. Are you following me?
Yes. What you are saying is right. But it won't be easy for me to find time for exercises.
Don't worry, I have an alternative option. If you don't have the time for a formal exercise program, you can still find ways to move throughout your day. Try these tips. Bike instead of driving to the store. Use the stairs instead of the elevator. Park the vehicle as far as you can from the door. Hand wash your car. Clean your house. Walk on your lunch break, etc.
Okay. That sounds like a good idea, nurse.
Perfect. Try meditation, or other forms of relaxation practices. Breathing exercises can be done, even if you are in the office or car, which is an instant stress reliever. Make meditation and exercise a habit. Also, you can identify your stressors, analyze your thought and behavior patterns over a period of time, and make a strategy to deal with them.
All right. That can also be done.
Now, maintain balance with a healthy lifestyle. In addition to regular exercise, there are other healthy lifestyle choices that can increase your resistance to stress. Eat a healthy diet, reduce caffeine and sugar, and as I told you earlier, get enough sleep.
Oh, I see.
I will provide a booklet, which contains recommended diet plans, and categories of food to include and exclude, which will help you even to make healthier choices at restaurants.
That will be a great help, nurse. Thank you.
My pleasure. Ain, remember, consistency is also very important. For long-term healthy stress-free life, follow these instructions, and build good habits.
Sure, nurse. I understand that.
I wish you all the very best for a stress-free healthy life ahead.
Thank you, nurse.
You are welcome.
That is the end of your OIT speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.